Because she's been sick so long, and she's obviously having some difficulties breathing, okay, and those wings are really, really low. I just want you to know that by manhandling her, we can actually push her over the edge. That prey response can kick in, and she can actually die on us. Now, it's a very, 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 very rare thing, and in my 20 years, I've only had it happen once. And I will be as careful as I possibly can, but I just want you to be aware that's part of the issue. That stuff that I'm picking up off the bottom, to me, doesn't even resemble feces in any way, shape, or form. And to me, have a bird that's driven here from even Ocean Springs and not to have pooped in that cage is in itself a weird thing.
She usually does, but I'm only 5 minutes. I'm at the hospital.
Right. We could be looking at anything in here from egg binding to a ruptured egg. What I want to do is we're going to capture them up, kind of cover the head with a towel. She's going to hold them, and I'm going to palpate the abdomen and palpate the wings and try to find some reason for what we have going on. The blood work, if you went into the hospital, okay, and you had a possible infection, your white count would be naturally high. The other things, with the history that you gave me, as soon as you told me that her behavior had changed, that she was acting strangely with toys and the whole routine, that told me that she was actually starting to be in the mood for love, so to speak.
Oh, okay.
So all that made perfect sense to me. So the blood work really didn't tell me any more than what you told me just by listening.
Right. Okay.
But at the same time, that white count does make me nervous, and there's obviously an infection going on there somewhere. And seeing as how you have seen eggs very recently, it is very possible we could look at an infection there somewhere, which might need surgery.
Oh wow!
I'm hoping that I can palpate this abdomen and find some whole egg, and then it has been more than a week, okay, and see if I can get something out of here or make something positive come to this case at this point in time. Because it has been so long, I'm scared.
It's been 3 weeks since
most birds die. Most birds die of an egg that's ruptured or a problem like that within a week. Sometimes within days.
Maybe that's not what it is then, right? Yeah.
I really am kind of curious. So what we're going to do is we're going to catch them up, palpate while I'm in there, get a good palpation of everything else, maybe get a sample of what's happening in the mouth. Maybe we're just treating the wrong infection.
Okay. She is like 2 steps away from almost normal. In other words, if she wasn't, by the way, she did break her wing. I guess you saw
I saw that.
That was about a year and a half ago, or so.
Back in 15.
Yeah, 2 years ago. But and that was fairly, but that worked out real well. You see a feather hanging down on that right side that's still from that process. But she hasn't been sick in 20 years. She has not had anything. She hasn't been to the vet pretty much in 20 until she broke her wing. But what I was going to say was the couple things that she's doing abnormally. If she wasn't doing those, I'd say she's alert. She's moving around real well. I pick her up and whatever. She doesn't seem to be in any pain. I was giving her. I did for the first week or so the meloxicam or something, whatever, Medicam, and but anyway, if it wasn't for the fact that I'm not finding food all over the ground, all over her bottom of her cage because she's not eating the way she normally eats, and the fact that she's drooping her wings, she seems normal. She doesn't seem to be weird, and doing anything weird except the hanging of the wings and the change in the eating habit, and the fact that she stands in one place. I can tell because she goes to the bathroom in the same spot. Not anymore. She'll get out of the cage and go up and get on this completely separate wooden thing, and that's when she goes. She has a whole different routine. But anyway, that's what I'm noticing.
Okay.
You want me to leave?
Sure.
Okay. Because you're getting ready to hear something.
Oh yeah, these guys are never quiet. So you want to handle this? Am I coming in there after you, or am I just handle this thing for you? What's up? You can talk to me?
each other. They really don't like each other. And but she feeds her, and you know, and puts the water out. But see, I like with her sick, I give her water when I bring her fresh water.
Mm-hmm.
I let her drink it, and she always drinks a lot. You know, before I put it down. So.
Well, the metronidazole, the medication she was on, is really meant to treat enteric infection. So, was there a diarrhea before that you remember? No. Okay. And that's usually what you use metronidazole for: colitis, some enteric problems, that type of thing. Anyway, so that's a camera. That's just watching her. I have a YouTube channel. Put a lot of my patients on the YouTube channel.
Cool.
I didn't get her wrestling match on film, so her pride's been saved.
Oh, wow. Yeah, that's right. Yeah. Well, she, like I said the last time, she must not have been too aggressive. I mean, she can bite the head off.
She's one of those birds that's got one of the biggest beaks to deal with outside of a few other species of macaw. But like I said, she wasn't trying to bite us. She was just fidgeting and whining because matter of fact, she didn't try to bite me at all.
Yeah.
She had several times that she probably could have gotten my finger in there, but she didn't go for it.
Yeah.
She's not a bad bird.
No. She's not. My son can deal with her. My daughter is going to inherit her because as I get older, she's going to live. She's going to live for. She could live another 60 years, right?
In theory, we're trying.
I mean, assuming that she doesn't have a problem, but the life expectancy is pretty high on them. So you're looking at you looked at
got a swab of the nasal cavity,
Yeah.
okay, and I also got a fresh fecal sample that I can look at with a microscope. So give me a few minutes.
Okay.
I'll make some difference.
Did the doctor examine you? Did you go to the doctor? Did you go to the doctor? Bubba, did you go to the doctor? Did you go to the doctor, Bubba? Did you go to the doctor? Did you go to the doctor? Did you see the doctor? Did you see that doctor? Bubba, did you see that doctor? Did you? I'm getting ready to go home. You ready to go home? Ready to go home? Are you ready to go home? Are you ready to go home? You ready to go home? You want to go ride in the car again? We're going to go ride in the car? We're going to go ride in the car? Ride in the car? Go ride in the car? Ride in the car? Ride in the car? Ride in the car. Do I ride in the car? Do I ride in the car? Did the doctor check you? Laura, did the doctor check you? Doctor? The doctor check you? Yeah, doctor. Daddy doesn't like to go to the doctor either. Daddy goes to the doctor sometimes. Daddy goes to the doctor. Daddy goes to the doctor. Are you okay? Are you okay? You feel better? Feel better? You feel better? Did you see that big kitty cat out there? Did you see that kitty cat? Did you see the kitty cat? Did you? Did you see that kitty cat? Big kitty cat. That was a big kitty cat. That was a big kitty cat. Big kitty cat. Yeah, big kitty cat. You doing okay? What was that? Did you hear that? What is that? What is that? You ready to go home? It's your house? You get ready to go to your house? You go to your house? You ready to go to your house? Get ready to go. Doctor's gonna check on your poo-poo. Doctor's gonna check you. Doctor's gonna check you. Doctor. 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 Did you see that doctor? 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 Doctor. Doctor. Can you say doctor? Do you want to say doctor? You see doctor? Can you say that? Doctor. 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 Yes, doctor. 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 So you're having trouble breathing? You ready to go home? To your house? You ready to go to your house? Good. see that kitty cat out there? Did you see the kitty cat? You saw that kitty cat? You saw that kitty? You and a doggy? you hear that? Did you hear that doggy? Bubba Lou, did you hear that doggy? Doggy. You have an itch? Did you have an itch? You ready to go home? You ready to go home? Are you ready to go home? You ready to go home? Did you hear all that barking? It's the doggies. 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 That's a doggy. That's a doggy. That's a doggy. They sound like they're worse shape than you are. They may not even be sick. They may not even be sick. Those doggies may not even be sick. I'm ready to go home. You ready to go home? You ready to go to your house? Get ready to go to your house? Are you ready to go to your house? Ready to go to your house? Ready to go to your house? Nap nap. You ready to take nap nap? You ready to take a nap nap? Are you getting ready to take a nap nap? Something else she does a lot since she's been sick, and that's sleep during the day. I mean deep sleep. You know, her head's way down there. So she got a bug?
She's chock full of bugs.
Is she? Yeah, it's good.
Okay. Is this all about you? It wasn't so bad, was it? Started whining and crying, screaming at me. Good thing Dad wasn't in the room because there was some choice words you were using.
Yeah, we don't, you know, she can talk, but we discourage it. I mean, you can imagine how bad it could be. You know, I had a minor bird years ago, and that thing was unbelievable. Unbelievable.
Yeah.
I had a story. The realtors came in to look at the house, and I got two guys, and the monitor bird's cage was over here, and it was that dining room on the stand. They didn't even notice the bird. The bird walked in, the guys walked in, and the client, and then the realtor, and the bird had all different tones, you know, talked several, my grandmother's voice, my voice, deeper voice, or whatever. And she said all kinds of, my name's Sambo, birds can't talk, all kinds of stuff, you know. And when they walked in on the other side of the dining room, the bird said, "What's your name?" And the guy turned around and said, "I thought I told you my name." That's how good it was, you know, how clear it was. So that was a good story.
Okay, we are chock full of rods. Grandpa's and Granddad cannot tell you. I'm going to choose a broad spectrum antibiotic, akin to Cipro. It's actually stronger than Cipro. So if anthrax blows through, I'm sorry you're not going to make it, but the bird will do fine. And it's a once a day medication. You'll just basically like 0.4 mils once a day. This shouldn't taste as bad as the other stuff.
That stuff's peppermint or something. It's got a taste of it. Yeah, she's hard to give medicine to. Maybe you can give it to her the first time.
Oh no, that's not my job. I just do the diagnosing part.
I do that.
One of my clients actually will sit there and take up the food the night before. That way in the morning, they'll put down some special treat that will have the antibiotic and stuff mixed in it.
Yeah.
And then when they eat that, then you put the food down.
Yeah.
Okay, that's one of the best ways. Some of my clients actually took a donut and froze a donut and then sliced it along the, on the axis all the way around and got, several like little discs and put medicine on each one of those discs. And again, would put that in there first thing in the morning as a treat to make sure they got their antibiotic.
Yeah. I have a 100, it's honey, it's peanut butter, it's banana, honey by itself, banana by itself, a mixture of those, smashed, not smashed. But she does not like supplemental food. She doesn't, not interested in one application, one shot of supplemental food. She turns her head. She'll really avoid you. She turns her head sideways. So she's not interested in treats or. She's really hard. I have to take the peanut butter is the easiest thing, and I kind of put my finger in her mouth and kind of scrape it in there, and some of that she could spit out. Using this stuff, trying to get this stuff in her. So it's a liquid.
Yeah.
So get it as best I can, huh? Once a day.
Once a day.
How long?
We're gonna do this for about 10 to 14 days. Okay. If we're not seeing an improvement by, say, Thursday of next week or even by Monday, let me know. Okay.
This coming Monday?
Yeah. You should be seeing an improvement by Monday.
Because I'm going out of town Tuesday for a week, for the rest of the week. Or I won't go out of town.
No, we'll try to get you out of town.
See what happens Monday.
You got it.
But I might be able to get my son. My son can deal with her, but they don't. My daughter's the one that can do that. Flips her upside down and
she don't take no crap.
Right. Does her nails. Yeah. I can't even do her nails. I had her nails done. River or Ben, they did her nails when she was over there a couple of weeks ago.
What?
Bubba, is that your picture?
Don't want to come on. What's up?
She's she's a take charge person too. I had my one cat just died. But I have two cats and a dog in the house and a visiting boxer dog, which is a young dog. She's in. She'll get down on the floor, walk right by them. She's pretty much in charge. You trying to get in the roof?
Just playing with her. Okay, today we're at Bayview. It is Friday morning. They are prepping me for an eye enucleation on the smallest kitty I've ever done surgery on. That's not really the truth, but it's pretty small.
Yeah.
They talked me into it last minute. Anyway, you're looking here at this cute little macaw. Not really all that small, but you get the idea. This one here has been treated for several weeks at a referring veterinarian on metronidazole. I anticipate that they thought we had some diarrhea or something going on the physical exam. The cloaca was fine, no problems. That might be because of the metronidazole. But what was bothering me is our choanal slit had dull papillae, and as you can see, our wings are hanging, and we're definitely having a little bit on the a hard time breathing here. So anyway, went to the slide of the choanal slit and got a sample cytology, and we're seeing tons and tons and tons of rods, a site greater than 100 per high-powered field, and actually seeing some white blood cells that have migrated in that area to help fight the infection. So birds, in their infinite wisdom, basically have completely different breathing apparatuses from you and I. Their lungs are basically a sponge, which actually breathes the air twice. So they're, completely opposite from any way we are. Any little bit of bacteria can cause twice as much damage. So anyway, hopefully we're on the right track now, and we'll be able to see this one here do a whole lot better within the next few days. Dad's instructions are if he sees no improvement by Monday to let me know. Dad wants to leave town on Tuesday, so we'll see if we can get Dad out of town.
Okay.
What? Oh no, say something. What? I know. Raka raka. I know. These things are insured. If you really want to crack one open, it'd be funny as hell. It would. Yeah, it would. Yeah. So Best Buy would be like, what happened to this camera? I'd be like, oh no, a bird got it.
Explain that to your insurance people. Bird attack.
What? Oh, there you go. That's a birdie kiss.
And you got it on film.
Birdie kiss.
Oh yeah, she gives kisses too.
Birdie kiss. Oh, another one. Very good. Birdie kiss. Very good.
She relates to that word. You can tell her kiss, and
she's not a bad bird at all.
No, I think I've got her built up too bad. In other words, because I know what she can do. She could.
Oh yeah, well you don't want anybody walking into the cage and going, "Oh, I can pick this bird up."
Well, they do. They think they can. And I bought her macadamia nuts one time years ago, thinking that was great. Whole bag. I don't know how many bags I ordered them. And you know what a macadamia nut is to crack open with a hammer even. Man, she just pops them just like that.
Yep.
There's nothing to it. Bubba, give kisses. Can you give kisses? There you go. Good girl. Good girl.
And what's this Bubba girl thing?
Well, she was the big bird of the litter. The bunch. I bought her. The pair was there in South Florida, where all the birds are down there.
Mm-hmm.
I lived in Delray Beach, and she was the biggest bird and a dog in the house, and a visiting boxer dog, which is a young dog. She's in. She'd get down on the floor, walk right by him. She's pretty much in charge. You trying to get the roof?
I'm just playing with her. Okay, today we're at Bayview. It is Friday morning. They are prepping me for an eye enucleation on the smallest kitty I have ever done surgery on. That's not really the truth, but it's pretty small.
Yeah.
They talked me into it last minute. Anyway, you're looking here at this cute little macaw. Not really all that small, but you get the idea. This one here has been treated for several weeks at a referring veterinarian on metronidazole. I anticipate that they thought we had some diarrhea or something going on the physical exam. The cloaca was fine, no problems. That might be because of the metronidazole. But what was bothering me is our choanal slit had dull papillae, and as you can see, our wings are hanging, and we're definitely having a little bit on the a hard time breathing here. So anyway, went to the slide of the choanal slit and got a sample cytology, and we're seeing tons and tons and tons of rods, a site greater than 100 per high-powered field, and actually seeing some white blood cells that have migrated in that area to help fight the infection. So birds, in their infinite wisdom, basically have completely different breathing apparatuses from you and I. Their lungs are basically a sponge, which actually breathes the air twice. So they're, completely opposite from any way we are. Any little bit of bacteria can cause twice as much damage. So anyway, hopefully we're on the right track now, and we'll be able to see this one here do a whole lot better within the next few days. Dad's instructions are if he sees no improvement by Monday to let me know. Dad wants to leave town on Tuesday, so we'll see if we can get Dad out of town. What? Oh no, say something. What? I know. Raka raka. I know. These things are insured. If you really want to crack one open, it'd be funny as hell. It would. Yeah, it would. Yeah. So Best Buy would be like, what happened to this camera? I'd be like, oh no, a bird got it.
Explain that to your insurance people. Bird attack.
What? Oh, there you go. That's a birdie kiss.
And you got it on film.
Birdie kiss.
Oh yeah, she gives kisses too.
Birdie kiss. Oh, another one. Very good. Birdie kiss. Very good.
She relates to that word. You can tell her kiss, and
she's not a bad bird at all.
No, I think I've got her built up too bad. You know, in other words, because I know what she can do. She can.
Oh yeah, well you don't want anybody walking into the cage and going, "Oh, I can pick this bird up."
Well, they do. I mean, they think they can. And I bought her macadamia nuts one time years ago, thinking that was great. A whole bag up. So I don't know how many bags I ordered them. And you know what a macadamia nut is to crack open with a hammer even. And man, she just pops them just like that.
Yep.
I mean, there's nothing to it. Bubba, give kisses. Can you give kisses? There you go. Good girl. Good girl.
And what's this Bubba girl thing?
Well, she was the big bird of the litter. You know, the bunch. I bought her. The pair was there.